Heart and Techy, Diastology Series, Part 2, Diastolic Function Assessment and Echocardiography. There are various methods are available for evaluating diastolic dysfunction. When assessing the diastolic dysfunction, blood flow velocity across mitral valve and mitral annular plane velocity are mostly used as a standard assessment. Mitral flow velocities are measured using both pulse wave and tissue Doppler imaging. These are the recently published guidelines by American Society of Echocardiography for assessing the diastolic function, based upon E-wave velocity, E/E ratio, E/E prime ratio, tricuspid regurgitation velocity, left atrial volume index. We are grading the diastolic dysfunction as grade 1, grade 2 and grade 3. The motion of the mitral valve annulus mirrors systolic as well as diastolic events. During systole the annulus moves caudally towards the apex, and during diastole it moves cranially towards the atrium. The motion of the annulus can be recorded with the help of both pulse wave and tissue Doppler imaging. Tissue Doppler at the septal as well as the lateral ring in a 4-chamber view. The sample volume should be placed approximately 1 cm within the insertion of the mitral valve leaflets. Very little or almost no filling occurs during diastasis, however, when diastasis is rather long, example in bradycardia, and a clear separation is seen between the E wave and the A wave, an additional L wave may be observed during mid-diastole. Thus, a prominent L wave also denotes diastolic dysfunction. Diastolic dysfunction with impaired LV relaxation develops early in most cardiac diseases and can progress to include increased LV stiffness, which leads to the elevation of LV filling pressures. Echocardiographic measurements of diastolic function reflect tissue changes and therefore provide important prognostic information. Thank you. Stay tuned with Heart and Techy. Do like, share and subscribe.